There. Can you
Hey.
hear me?
Yep.
Okay.
Hey.
Hey. Ooh, it's a lot of people. How are you?
I'm doing okay. A little
Okay.
afternoon tiredness, but
Yeah, I'm trying to get rid of it.
I feel like everybody's like sleep cycles and everything like that is just so out of whack right now.
Yeah. But we're up and we're here.
We are.
So, you ready to get started?
Yeah. Yeah. 6:04. I feel like we can.
¿Habla español? No. Pequito.
All right.
There is going to be a Spanish version available on Facebook, correct? Or there's
It's
information
gonna
in
be
S.
it's gonna be live on Instagram tomorrow.
Okay. So there's going to be one tomorrow. Tune in. Okay. So Will, you want to go? Go ahead.
Yeah, sure. So my name is Will, and I'll be one of the presenters today. I am the Bathhouse Initiative Coordinator and Volunteer Coordinator at the Community Health Department at Whitman-Walker. Although you're more likely to run into me either on one of these lives or at the front desk at 1525 14th Street or on patient engagement calls these days, because that's what I've shifted to because of the current situation.
Yep.
And I use he, him, or they, them pronouns. And I'm here with my friend Elcid.
So my name is Elsa Johnson. I am a youth ambassador at Whitman-Walker Health, specifically for the youth department. But I am also a part of community health, and I use he, she, they, whatever you feel like, for real. And today we are going to talk about health disparities, right?
Yeah, so during the past few months, Whitman-Walker's Community Health Department has expanded its outreach events or efforts on social media platforms. We cover various topics about HIV, STIs, sexual health practices, access to care, social determinants of health, and just general public health interventions. The next series of outreach events will focus on the current pandemic, COVID-19, and ways that you can manage your sexual, personal, and mental health. And the Community Health Department is here to educate and support you. So yeah, and this is the next part of that. This presentation is on LGBTQ plus COVID.
Hey. So, why us and why different? So a lot of people seem to feel like all of the information for COVID-19 is like general. Like why specifically the LGBTQ, why our community, and how does it affect us? What's different?
Yeah, so I mean, the thing to remember about COVID and LGBTQ people, and frankly, like any sort of virus, is that COVID is going to infect you no matter who you are, no matter what sexuality or race you identify with. So it's like COVID isn't going to discriminate, but the institutions and the norms that we have in place that are fighting the virus, that are aiding people in keeping themselves safe, are discriminatory. So, LGBTQ folks and minority communities are more likely to experience healthcare discrimination, and that discourages you from seeking care in the event that you contract COVID or any other disease. And in the case of a pandemic like COVID-19, this can have fatal outcomes. We're already seeing disproportionately higher rates of COVID-19 related infections and deaths in Black and Latinx communities. And yeah, it's important to know, to make a support plan in case someone you know or someone you live with needs access to medical care, just to make sure that they are going to a place that's going to accept them, and that they're not going to experience that discrimination. And you know, even before this pandemic, 17% of LGBTQ people lacked health coverage. So just from like an economic standpoint, there's also that barrier there. You know, people, if you don't have health insurance, and you just can't afford medical care, then that is going to be a barrier for you. You know, 1 in 5 LGBTQ people has decided not to see a doctor because they couldn't afford it. And you know,
that's really bad. Like, and when you speak on affording healthcare, it brings up so many issues, like not only affording medicines when you actually do get to see the doctor, but also affording to be able to go see the doctor, getting to your appointments, because there's not always a doctor's office right down the street, and sometimes you have to travel across town. So those can be a lot of different disparities that add up to one big ordeal.
And you know, that it might not seem like a whole lot when you are missing one yearly physical or something like that, but when that happens year after year and you're just not getting the primary care that you need, then ultimately that's when we see LGBTQ community and other minority communities experiencing higher rates of chronic health conditions, like, you know, asthma. There's certain cancers that are highly prevalent in the LGBTQ community, just because people aren't getting the screening that you need to prevent against these things. And when it comes to COVID, one thing that we're seeing is that LGBTQ folks are heavily impacted economically as well, and also other minority communities. But you know, we have a statistic here saying that the top 5 industries that LGBTQ adults work in are heavily impacted by COVID-19, and more than 5 million LGBTQ workers, or 40% of LGBTQ workers, are, you know, at risk of losing their jobs because they're in these industries that are being affected by this. And when you lose your job, then you lose your health coverage, or at least you're liable to do so. And that goes back to, again, to the 17%. That was before the COVID pandemic. And
it's,
you know,
funny
as more people get unemployed.
It's funny that you bring up, it's not funny, but it's ironic that you bring up the LGBTQ adults who work in these industries, because most of us are community health workers, most of us are outreach workers, and so we're put on the front lines. And then when you lose your job or your insurance, it's like you're just like the people you were helping. So it's sad to see that, but more than 5 million is a big number.
Yeah, when you see these numbers every day, you kind of lose perspective. But 5 million, that's a lot of people. That's a sobering number.
Right. So with COVID-19, there are a few reasons why LGBTQ folks, among other minority populations, are a little more vulnerable to care shortages, economic harm. Things like LGBTQ people are more at risk for immunocompromised things like HIV, cancer, and it has more severe health impacts on us who identify with that. A lot of people tend to either feel like they can't go to different places to receive healthcare because they identify with the community. And I have a fact here that states that according to according to the cancernetwork.org, 50% of LGBTQ folks are 50% more likely to smoke. And right now we're battling a respiratory illness, which is not the best thing to be doing. So I think, reaching out to some smoking cessation networks and programs will really benefit that. And there are some barriers that we deal with on a cultural basis, a discriminatory basis, such as even being me, a Black gay man. It's not only I'm just gay, but I'm also Black. So sometimes it's harder for me to find specific healthcare and healthcare providers that identify with me specifically and can understand my problems.
Yeah.
So
that actually see your health problems in the context of your life and what they mean for you.
Right. So a lot of people have questions about where you can receive health care for people who are LGBTQ, people who are of a different minority, and Whitman-Walker is the place. So if you click the link below or go follow us, you can find out all the information that we're talking about today for those of you who are just joining us. And for those of you who already know us, just look at and refresh some of the things that we have available now online as well. So what should we do if we have a partner, if we don't have a partner? What are some things to do? Like, can I have sex during COVID-19? There are a lot of people who seem like they can't, because in this community, we are limited to the amount of people we have access to. And then, sometimes there are other things that are involved. So can you have safe sex during COVID-19?
Yeah, so I mean, the main thing, we did want a live on this a few weeks ago, and I was actually a part of that as well. And really the main thing when it comes to sex and COVID is that it's not technically a sexually transmitted disease, but it is, since it's a respiratory illness, it's really easy to contract it if you're just in the same physical space as someone else. And obviously, in-person sexual encounters, you're literally up in each other's business. So, there's a pretty high chance of transmission there. Kissing is COVID is present in large quantities in saliva, and so kissing is actually a very effective way of spreading the illness. And it's really just about who you're inhabiting the same space as. So if you're having sex with someone that you live with and that you already spend a lot of time with, just because of other aspects of your lifestyle, then you're not introducing very much extra risk into your life. But if the person lives in another area and is like having to travel in, and they have all sorts of like interactions with folks that you don't have, then if you're having sex with them, then that introduces a certain level of risk. And so definitely like the number one tip is to just try your best to have sex with those close to you, and that means yourself or people who are living with you.
Masturbation is probably the best.
Yeah, and we definitely recognize that not everybody has the ability to make that choice for themselves. And there are certain things that you can do if you are having sex with people outside your household. Then just refraining from kissing is a good idea to minimize risk. Making sure that you're using condoms and dental dams. There's some amount of the COVID virus in fecal matter. So it's especially important to be using dental dams when rimming or just any like contact with that area is involved.
So just like beefing up on our sex safe practices already.
Exactly.
Yeah. In inclusion to that, I noticed that it depends on who you have sex with and making sure that you and that person are both taking care of each other health wise. So making sure like we both take PrEP or PEP if you're on those, and make sure you adhere to treatments for other conditions, whether that means learning how to use like your telemedicine portal, so like calling your providers and making sure that you get refills on your PrEP and things like that, stocking up on medications and taking them as directed, because right, right. A lot of LGBTQ folks are sex workers as well, and so that puts them at a great risk. So not only are they losing jobs, their money, they're also losing their health. And so make sure you're enrolled in health insurance, guys. That's a major thing. Like health insurance is really, really important. And so there are some enrolling periods for Medicaid that have come through private insurance plans like DC HealthLink. And even in DC, people who have lost their jobs, and they lost their insurance that's connected to their jobs, they have a 60-day enrollment window as well. I believe is it on DC HealthLink, or I think it's available all across DMV.
Well, yeah, DC HealthLink is just the online place where you can sign up for enrolling in Medicaid or a subsidized private insurance plan on the marketplace. So really all those things are just, they're part of DC's response to the epidemic, and they're trying to sort of have more enrollment periods, increase people's ability to apply for Medicaid and insurance through the marketplace. And that is a key detail, that if you have recently lost your job, there is a 60-day enrollment window from the day that you lose that job and lose your health insurance that's associated with that. And if you would like more information about that, you can try going to dchealthlink.com, or you can also call our insurance helpline, which is 202-745-6151. That's our public benefits department. During business hours, they're just on call to answer all your questions about insurance enrollment, getting yourself covered, and that way you can help pay for those medications that you need to be staying on top of, in terms of taking them and making sure you have enough during these days when there can be decreased access to to those healthcare resources, because pharmacies and doctors' offices are public places that are trying to decrease their in-person activity.
Exactly.
Also, what are some other measures that people, speaking of that physical distancing, like what are some considerations for LGBTQ people when it comes to not just the fact that the health part of it, but the social response that has caused this massive amount of distancing?
Yeah. So there are a lot of people. Oh, hold on. I think there's a question. So if you're a smoker, there are some smoker cessation programs, especially here at Whitman-Walker Health. If you need questions on that, you can call 202-797-4439 to engage in those programs as well, because I know that is a big health concern, because you can't just like quit. But some things that are different for LGBTQ, like youth especially, and us in general, we're more likely to have anxiety and depressions when we're alone, because we feel sometimes alone already, and it can be exacerbated when we're told to stay in the house and no, you can't go out, and no, you can't frequent Nellies and things like that. And so these are things that we do on a regular basis, and we're told to stay at home now, and it's like, well, I can't do anything from my room. And so I think there are some things that you can do. You reach out and you call people. You check with the people in your community. There's a big ballroom community. There's a big queer community here in DC, and all over the United States. And I think you have to think creatively about ways to support each other. So if someone needs help, they may not reach out. You have to you can actually send mail now. You can actually give mail to the mailman and let him take it to someone, rather than you go see their house or drop something off. You can let them do it, and no one expects a handwritten note just to see how you are. they check the mail, but they don't expect that. They expect bills. Well, I guess bills are stopped now, but you can do that. You can video chat. You can use Zoom, Instagram, Facebook, Microsoft Teams. There's a lot of different things that you can do to engage with people. It's time to immerse yourself, right? Like you got to get some books. You got to get some movies, TV shows. I've ran through everything on Netflix. I'm not sure if you've seen a couple of things on Netflix, but they seem to just drag on after a while. So you got to try to switch it up. So I'm gonna get some books and things like that.
Yeah.
And then sometimes there are people who are in situations where they can't be themselves at home, where they have to hide part of who they are. And for a lot of us who are out and who are openly gay, we can understand being put back into a box where you're not allowed to be yourself anymore. If I came home and my hair was red and I had to just deal with it, my parents didn't like it. There's things that other people go through that we're not really privy to, and so some people may be forced to stay with non-affirming parents, forced away from people who they actually feel like are their families. So you can journal and write and express these feelings and keep them in to yourself. If you're on the go, you can jot down in your notes, and just try to communicate with someone or something, how you feel, because getting it out really does work. So if conversation is not an option, there are some articles that you can send friends, that help about gender affirmation and things like that. There are online communities, such as like the Trevor Project. They created a safe space for people to join, online. So there are a lot of different things.
That's
And like
awesome.
we even have a live coming up on May 1st about wellness, through the youth events. So there are a lot of different things that you can do to stay safe.
Yeah. Yeah, you really like this is the time to lean on those connections that you have. Not just in terms of like social media. Like a lot of us can get sucked into just like scrolling through your news feed. It's like, yeah, like okay, I follow affirming Instagram
Right.
accounts, but like that's really nothing compared to talking to someone who is part of your support network over the phone and really having a good conversation and being able to support each other, because that is still possible. You can still talk to your friends, you can still talk to your mentors, you can still talk to your chosen family, but you just can't quite be with them in person. But you can still definitely lean on those connections, and this is the time for that.
Yeah. So, Will, I think we have a few fans. So you can access our lives. Our lives here. Oh, other lives, like our personal Instagrams and stuff. So we have some Instagrams that will be linked to Whitman-Walker Health, on their Facebook, on their Instagram, and you can follow us and the rest of our colleagues on there as well, because we have some TikToks and some Instagram lives going up this month.
Yeah, we're all over the place.
Yeah.
Yeah, and we have our past ones on Instagram as well. Yeah, were there any other questions that we had?
There is a couple of questions. Let me see. There's one about mental health, and where okay, yeah, like you can get where you can get mental health help, I believe. I don't know, she was talking about it.
See that one. Yeah, I mean, our behavioral health department they're pretty busy these days, but they do have some openings, so it's definitely worth giving them a call if you feel like you're in need of that. Yeah, and then again, like our wellness live, and our youth events, just in terms of like taking care of yourself. It's not the same as professional help, but you can definitely engage in that self-care, and we can help you out with that.
Yeah. So we gave a lot of information just now. You want to try to like summarize everything for everybody who isn't watching, and some people click through and they can get all the information at once. Um, and there is one question. There was a wellness one with so many tips. So yeah, there are a couple of wellness ones. There are the lives are saved on the page, and there are also a couple of ones. There was one earlier about mental health with Sarah Lawson, I believe, and then there's one tomorrow. There are a lot of lives. So just click in and check the page. We always give a mental health or a wellness tip with everything that we do, because we're trying to stay safe and stay sane as well. So go ahead, I'll let you take it away, Will.
Yeah. So we were mentioning a little bit just about reaching out to friends and just people who are supporting you, and just making sure that you're doing that. That also, applies to in terms of relationships, like the CDC, the WHO, and us here at Whitman-Walker are discouraging traveling to and from a partner's house if you don't live together, just because of that space thing that we were talking about, that you want to minimize the amount of different spaces that you're sort of exposed to. And definitely consider video calls, sexting, phone sex, just for like staying connected with your partner. One tip that I've found useful in my own life is just thinking of your relationship as a long distance relationship, even though you might be like a mile away. Just like taking that approach to it is really helpful in just making sense of the situation. And in this time, it's really important to strengthen communication and set boundaries for how often you're interacting and what type of interaction you're having. Because a lot of the miscommunication that can happen over digital means comes from people sort of preferring different methods of communication, or making assumptions about the way the other people are seeing them based on their actions that aren't necessarily true. So if you communicate more about that, then it'll mitigate the amount of anxiety that you're having through that miscommunication. And also just like be kind to each other, assume the best. It's a tough time for everybody, and we need each other. We need positive interactions with one another. We need to be supporting each other during this tough time. And also make sure that you're taking care of yourself, like know what you need and like prioritize that, so then you have the energy to give other people the support that they need. Because if you can't love yourself, how in the hell are you supposed to love somebody else?
Okay, come on, RuPaul. Oh, speaking of RuPaul, yeah, there's a tip too. Make sure that you guys stock up on makeup. CVS is still open, even though MAC and Sephora are closed. So those of us who wear makeup, make sure you go and check it out. Even for us who are darker skin tones, Black Opal is in CVS as well. They have a lot of different things. I think I have.
Right. Because makeup can be on the same level as like a life-saving medication,
It helps you feel better when you look better.
doesn't deem makeup an essential service, but it definitely is for a lot of folks.
Yeah, they say that people are spending more on beauty supplies, like hair color. That's the phase we're supposed to be in, where everybody's changing their hair, because they can't do anything, even though no one's going to see it.
I was ahead of the curve on that one.
Oh yeah, I bet it back. But yeah, so makeup, and make sure necessary appearance related supplies. I got some stuff too. Oh, and health insurance. So that's a big one. We talked about the DC Health link and making sure that people who lost their job related insurance can sign up. And I think we'll include that information either below or on our page as well.
Yeah, I'm actually going to send out the phone number for any questions that people might have about insurance for our public benefits insurance line.
Okay. Oh, and then for gender affirming care or affirming healthcare, Whitman-Walker is a big one for those of you who are watching. And then for those of us who are on the other side of town, Washington Hospital Center is available as well.
Mm-hmm. Just type this in. You want to go over just a quick review, final points that
I see an ear.
Can take home?
So what we were just going over was making sure that you have the necessary materials to make sure that not only that you look your best and feel your best in the house, but making sure that you have your insurance and making sure that people who have lost their job provided insurance can enroll through insurance through the DC Health Link. So that's what I guess you missed.
Mm-hmm. Yeah, and if you have any questions about that enrollment or like your eligibility or your coverage, just give us a call at our insurance hotline. I just posted it in the comment section, and we'll be able to help you out there. All right.
So we have to stay physically distant, but digitally in touch. This tongue thing where I talk too much.
No, exactly. And I mean, that's like a really big takeaway, not just for LGBTQ folks, but for everybody. You know, just because we're physically distant doesn't mean that we have to be socially distant, right? Like we can still stay connected with the communities that support us, which is especially important now that we've, you know, kind of been forced to cohabitate with biological families and not necessarily chosen families.
Right. And I think you can see how like close I keep getting really close to the camera. I think I'm wanting to be around people.
Yeah, just getting closer in. Another key takeaway, make sure that you make a plan for if somebody that you know who's in your household gets symptoms, and that's like, where will they get tested? If there's an emergency, where will they go? Do they need to be accompanied to make sure that they are treated properly in healthcare settings? And just making sure that you're talking about that and planning for that. You want to make sure you know where the affirming healthcare institutions are. Whitman-Walker is, you know, great. Yeah, if you can come to us, then definitely come to us. There's also some things like, you know, we don't have an emergency room. So just in terms of, you know, looking up, research has dictated that Washington Hospital Center is good for that. But if other people in the community know of other places that they've been treated well, then just like make sure that you're staying on top of that.
Don't physically come to us. He means like call or online. Telehealth, don't physically come. Sure. We are not open. We're people.
Another one, if you smoke, consider seeking out a smoking cessation program like the one that we have at Whitman-Walker. And make sure that you're adherent to treatment for other health conditions, whether that means learning how to use your provider's telemedicine portal, or making sure that you're stocked up on meds, you know, making sure that you're adherent to those. Just because we have this one, you know, we're having a COVID moment, right? COVID's like having its 15 minutes of fame. But just because that's happening doesn't mean that other health conditions and other, you know, like STIs and HIV and stuff like that go away. So you need to make sure that you're still taking care of yourself on that front. Yeah, and stock up on or plan to borrow makeup or other necessary appearance-related supplies, and make sure you're covered with health insurance. And if you don't have that, now would be a great time to look into that, either by going to DC Health Link or calling us at 202-745-6151 for our insurance hotline.
I mean, well, yeah. You don't seem to have a problem finding like barbers or anything like that. You got your hair cut. A
I
lot of
got my
barbers
hair
are
cut
closed.
hours before the barbers all closed.
Oh. Oh,
So
okay. Yeah, I got a hat on. Yes, but let's kick COVID out of here. Yeah, so stay home.
Touchy Kool-Aid got it right.
Yep.
Yeah.
So does anybody have any questions? Let me see. Let me go back through.
Yeah, I don't think there were any other ones posted, but if
Nope.
you have a question, post it now or call up the resource line. Honestly, it's not forever hold your peace. It's
Yeah.
post it now or just give us a call during business hours.
All right. So you guys can follow me too. I'm at ELCIDD_.
All right.
All right. You're welcome. I'll talk to you guys later.
Yeah. See you later, Elcid.